I welcome everybody to this epoch-making event. Indeed, it is a dream come true for me, the entire Ministry of Health, and the Anambra State at large. Health insurance is a system of advanced financing of health expenditure through contributions, premiums, taxes paid into a common pool to pay for all or part of the health services specified by a policy or plan. Many of such advanced payments existed and still exist in most parts of the world and in various forms. For instance, Nanibu, is what we call an isusu model, and that's a situation where money is contributed into a pool by consenting groups, usually kept in a custody by a member of such group on trust, and later such money is given out to each member in turns as the need arises. Health insurance, therefore, is an advanced model of isusu, and therefore it's not strange in our environment. And the new model of health insurance scheme is not based on trust, but on inbuilt checks and balances to prevent mismanagement. In summary, the objective of health insurance include to ensure that everyone, particularly in the Anambra in this scheme, has access to a good health care services, to protect families from financial hardship of huge medical bills, and to take rise in the cost of health care services, to ensure equitable distribution of health care costs among different income groups, and to maintain high standard of health care delivery services within the scheme. Because the health facilities that will be offering these services will be the ones that will be accredited by the health insurance scheme. And we were very careful in the health facilities we selected, both government and the private, making sure that we excluded Mamo Ejima and Papa Ejima and other groups. And also we want to ensure adequate distribution of health facilities within the state, because the health centers are actually selected based on secretarial zones and the local governments. And of course, to ensure availability of funds to the health sector for improved services. The danger of out-of-pocket expenditure for health cannot be overemphasized. Although the rich can contend that, but for the middle income earners and the poor, most often it is a death warrant, especially for those who have nobody to bail them out. This latter observation is what actually prompted Executive Governor, His Excellency Chief Doctor Obiano, to seek a solution to this challenge of out-of-pocket expenditure for health. And that's actually what necessitated the formation of Anambra Health Insurance Scheme. Since the inception of this administration in 2014, the government of Anambra State has spent nearly 300 million naira as a bailout to people who were held captive in both private and public hospitals due to inability to pay. And also some other ones that needed money for one form of medical assistance or the other. This journey to establish a financial model we are celebrating today is in a way not an easy task. It took the state nearly 4 years to come up to this stage. We understudied different state draft laws on health. We studied the National Health Insurance Scheme, and we actually worked with them. I will thank the Executive Secretary that is here and all your people that are working in both at Anambra and Enugu. They worked with us tirelessly for the past 4 years, and that's one of the reasons why we were acknowledging some of the things that we are telling you that you'll be able to do. At the time, We were held between the fear of hurriedly pushing out a system that may fail and being too analytic that we nearly got paralyzed in the process. We thank in a special way the Executive Governor of Anambra State for the patience, because I will tell you that he would want the scheme to be launched as if it were yesterday. But it was never so. We fought forward, backwards, before we were able to read this. And the essence is to have a sustainable system that will stand the test of time. The agency has an office complex located in an ambient environment in Oka, just opposite the government house, fully equipped and having adequate human resources for effective implementation of the scheme. The chairman of the board is Professor Ilo Chukafo, an eminent professor of law and the former vice chancellor of Nanda University, Oka.
Buttressing this fact is the health insurance coverage for Anambra State, which, like other states, remain at less than 1%. This, therefore, can explain the poor health indices that is obtainable here, despite the modest effort made by the state to upgrade its health infrastructure, as has been alluded to. Therefore, to achieve the 8 targets of the Sustainable Development Goals of the United Nations, which states achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. It becomes clear that having an effective and efficient health insurance scheme is critical. To ensure this in Anambra State, the Anambra State Health Insurance Agency was established by the Anambra State Health Insurance Scheme Laws 2016, with the mandate to ensure that every resident of our dear state has access to quality and affordable health care, improve healthcare services, and ensure adequate and equitable distribution of health facilities within the state, in a manner that will ensure that the man who lives in the riverine communities of Anambra, in a manner that ensures that the man who speaks Igala and lives somewhere at the other end of Anambra has access to quality health care. The agency will take necessary measures to plan, organize, and develop medical and other health services commensurate with the needs of these residents in cases where these residents do not have available medical and other such health services. To deliver on our mandate, we have accredited so far 2 tertiary, 36 public secondary, and 155 private hospitals and faith-based hospitals in the state. And then to ensure that we further take this to the remotest parts of our state, like I had just said, we have adopted all 566 primary healthcare centers spread across all of our 179 communities in Anambra. Our agency has embarked on the sensitization of our people on the availability of this scheme, which we are here to formally launch today. On account of this, we have actually commenced registration of some enrollees. We are not leaving any sector behind. Unlike what obtains in some other climes, we are going headlong, taking persons in both the formal and informal sectors to come on stream. We are collaborating with and would continue to engage leaders of religious, traditional, professional, and social institutions and bodies in Anambra State and beyond. The enthusiasm of our people towards the scheme thus far makes us highly optimistic that within the next 1 year, our prepayment coverage would have increased from below 1% to at least 30% in a manner that will set us on course to achieve the SDG's universal health coverage target of 90%, well ahead of the year 2030 target. The tremendous political will demonstrated by His Excellency Chief Willie Obiano, the Executive Governor of Anambra State, towards the success of this scheme is palpable. Everyone around this state knows that. And that is highly reassuring to us as an agency that with that we are definitely going to meet the above stated targets as well as sustain the scheme. Anambra State Health Insurance Agency is going fully digital. Just a while ago we had demonstrated this to the Executive Secretary of the National Health Insurance Scheme, Professor Usman Yusuf, when he paid a courtesy visit to our office, and that will also demonstrate here in a little while with registration of His Excellency. In addition to having a quality assurance team that will regularly visit health facilities to ensure that service provision complies with minimum set standards, We have set up a 24-hour call center, which was also seen by the Executive Secretary of National Health Insurance Scheme, for real-time resolution of enrollee and healthcare provider challenges. We will institute eventually an annual award ceremony where we will recognize and honor those who channel their acts of charity towards providing health benefits for the vulnerable in our society, and honor such men and women as Anambra pillars of healthcare.
Anambra State Queen. With Win. Thank you very much. So, ladies and gentlemen, I'm very glad to be here. This is the birth of our baby too. This agency is our baby too. We have been working with the state government, the state commissioner, the now executive secretary for the past 4 years. We are very happy to be here. I'm in the labor room, the baby is born, the baby is well. So this is what I tell every state I go to. NHIS as an agency in Abuja, we cannot achieve universal health care coverage without involving the states. The states are where our people are. The states are the ones that need to cover more people to come to the center. And that is why, ladies and gentlemen, you will see me all across this country, from the edges of the Sahara to the creeks of the Niger. Yesterday I was in Kazina. The other day I was in Asaba, Calabar. Next time I will be in Lagos. The whole idea is to get all state governments to create an agency like this. It has not been easy, we know that. And this is not the work of one person. This is the hard work that everybody in this state has put in. From the legislature, to labor, to civil society organization, to, and this is what I tell this agency, you guys are doing it right. Why? We are starting with our parents, the clergy and our traditional rulers. They are the ones that will take us to the people, and the people will accept us. And their presence here honors me, and I feel greatly appreciative of their presence. Anambra State Health Insurance Scheme is starting on a very good footing. What is the footing? You have a governor who is very supportive. You have a governor who appreciates what it means to have a very healthy population. Without his support, and I've seen that in many states where the governor does not come on board. Without the support of Governor Willie Obiano, we will not be here. And for that, I appreciate you, sir. And what I tell all agencies when they come on board, do not repeat our mistakes. We in the National Health Insurance Scheme, and this agency in Anambra State, more than many, is heeding to that. They are doing the right thing. I have been to the agency. And ladies and gentlemen, His Excellency, I'm very proud to tell you I am a registered member of Anambra State Health Insurance. So ladies and gentlemen, what is health insurance? I have been out of this country forever, 30-something years. I came out here, seeing a few patients and doing research. I'm on a chair. This is the potential of this agency I see. We are sitting in an agency that has the potential to make a difference in the lives of our people across all 6 geopolitical zones. There is no greater honor than to serve. That's why we went to medical school, and I tell people severally, I will do this job for free. And I tell them we're doing God's work. We are helping the sick. We are helping the weak. Essentially, that is what insurance is all about. That we, the healthy, help the sick. We, the strong, help the weak. And those who have, help those who do not. It's there in all scriptures and all cultures. Ladies and gentlemen, all of us, from the richest to the poorest, when we go back home, who do we see? Those we've left behind. Predominantly women, widows, widowers, the sick, the aged. When they are sick, they do not go to hospital not because they don't want to go to hospital. They don't go because they cannot afford to. This is what agencies like this are supposed to do for our people. Give access to our people. I was in Ilorin the other day. One of the largest private practitioners saw to see me. He said, you are a pediatrician, you will understand that, you will appreciate this. The 5 biggest killers of children in Nigeria are malaria, diarrheal illnesses, respiratory illnesses, illnesses that can be prevented by immunization, and malnutrition. He said, sir, common malaria does not kill children. What kills children are complications from malaria. The cerebral malaria, children convulsing, malaria of the kidney, severe anemia, or severe dehydration from diarrhea and vomiting. He said, sir, since the onset of NHIS, I do not see severe malaria in children and death in children. Why? Because these mothers now, they have access. Whereas previously they would bring these children to the throes of death, now they bring them earlier on in the disease. That is what access gives to our people. And that is what this agency will give to the people of Anambra State. 14, the National Health Act that was signed into law says 1% of consolidated revenue will be dedicated to health. This time, the budget that Mr. President has signed has dedicated the full 1% into a fund called Basic Healthcare Provision Fund for the health of our people across all 6 geopolitical zones. The formula for distribution of this fund, and this fund is not only the federal government, development partners, Gates Foundation, and the World Bank have put in money, and many more want to put in money. What we are hoping and praying is that this fund outlives all of us. The Act is very clear how this fund should be utilized. 5% of that fund goes to the ministry takes care of emergencies. Recently we came out of Ebola, we came out of meningitis and road traffic accidents. The 45% goes to National Primary Healthcare Development Agency. National Primary Healthcare Development Agency is supposed to do 3 things with their money. Help improve the infrastructure of primary healthcare clinics, buy commodity into these clinics, and help in capacity building of staff of these primary healthcare clinics. How about NHIS that gets the bulk of this fund, which is 50%, if our people in villages. Now we're not talking big hospitals. We are talking primary health care where our vulnerables are. When people go in there and they are billed, NHIS is supposed to pay for them. Who are our people? Pregnant women, children under 5, the disabled, and the aged. Ladies and gentlemen, for the first time in the history of this country, we will see the number of those covered in the informal sector rising across each of the 6 geopolitical zones. We in the NHIS, we have made an undertaking that we are going to manage this fund transparently, accountably. There must be equity. All 6 geopolitical zones, local governments will be represented. And we're going to make sure this money reaches the front line, not through any third party. And Anambra State Health Insurance Agency is doing exactly the same. They are not going through any third party. They are making sure these hospitals and clinics get the money, which is the right thing to do. Fifthly, most importantly, is the NHIS, we want to aggregate this at disaggregated pools. If Anambra State today tells me we've covered 100 people, I will go back to NHIS and say we've covered 100 more Nigerians. We are all in this together. And I'm very pleased to be here, and I am proud to be associated with Anambra State. Anambra State Queen. Anambra State Queen. Queen's win. Thank you very much.
This is your 5th year in office, Your Excellency. But you have set a commendable example in Igbo land for leadership. When I look at road development, you are the first state governor that built a flyover in the southeast of Nigeria. And Ebonyi State has just followed you. Afioma Nelongwe. Since you became governor, Anambra State has not missed the first 3 positions in educational excellence in Nigeria. I'm an economist, and I read all economic parameters monthly. Anambra State has the lowest poverty rate in Nigeria under your stewardship. When my wife was alive, each time we visited her home in Obiano, she died 5 years ago, so Commissioner, please, not during your tenure. Each time we visited her home in Obiano, she was in a hurry that we should go. She would tell me, people notice that we have come, and they are probably waiting for us on the way. In fact, on one occasion, soon after we passed Nnamdi Azikiwe University, and in a place they call Agwoka, they began to shoot at my convoy. But luckily, I had some policemen who shot back. And clearly they must have shot someone, because after they shot sporadically, the shooting from the bushes stopped. But banks were donating to security in Anambra. Armored vehicles were all over the place. But it is not having money in the hands of someone, but having money in the hands of someone who knows how to use it. When Obiano came in, I began to see drones in the air. I began to see helicopters in the air. I began to see legislation that gave police empowerment to destroy the homes of convicted criminals who were kidnapping people up and down. So security in Anambra became the best. It was the worst. Even a former governor here had his wife kidnapped. But suddenly, Anambra became a safe haven. Hotels begin to spring up all over the place. And it is now competing with Owerri as the place for a weekend for any Igbo man who wants relaxation. So I'm very, very, very blessed by what I am seeing today. There is no doubt in my mind that in terms of personal development, the people of Anambra are renowned to be extremely enterprising, entrepreneurial, hardworking, itinerant, and capable of turning ideas into money. But what could be more beneficial than having a governor who is prepared to give them the instruments to become greater? What you have done today, Your Excellency, is when you make a person healthy, you make him think better, you make him become more productive. When you were threatened that there would be no election here, I came to address your legislature that there must be an election here. Because I said in that speech, Nangozi niile Chukwu nyere ndị Igbo n'oji ewe ndị Anambra. And I gave examples of it. Since Dr. Nnamdi Azikiwe, no Igbo man has been president of Nigeria again, at least from Anambra. Now, during Obasanjo, presidents of senates were distributed as if they were corn for chicken. But no other state in Igbo land has had 2 presidents of senate except Anambra, Orizu and Okali. No other state in the southeast produced a vice president except Anambra. No other state has ever produced a speaker of the House of Representatives except Anambra, and it produced 2. Yes. Now, if I go on, it's gargantuan. An Anambra man produced the fastest computer in the world. Chukwu nyere unu onyinye dị iche iche. Ka o nyekwara unu, lotekwa na ife anyị na-agụ n'ụlọ anyị. Onyinye Chineke dị iche n'iche, amara Chukwu gbaa mbọ mara nke Chineke nyere gị were ya rụbara ya ọrụ. Obiano onye ni iji arụrụ ọrụ, Chineke gọzie ya.
His Excellency formally launches this aspect of fundamental objective and directive of state policy. Today, the thinking, he has no money, let him die. That thinking dies today. I'm not the person. Today, His Excellency assures us all that there will be affordable, equitable, accessible, effective, and quality medical care and treatment available for all residents of Anambra State, irrespective of tribe or origin. Today, His Excellency says to us that the health of residents of the state is a primary concern, not only to his government, but to generality of all of us. And that collectively, we will ensure and thereby share the health risks of one another. This laudable, indeed obligatory obligation can, however, be best achieved when the wide generality of our people, both public and private, formal and informal, embrace the scheme. I want to use this opportunity to thank His Excellency for the opportunity given me and the entire Governing Council to serve the state at this crucial moment of revolutionizing healthcare delivery in Anambra State. We appreciate the trust and the enormous responsibility laid upon us, and we will do our utmost to firmly and widely further and uphold your legacy. Since my appointment on August 1st, 2018, I've interacted with the Executive Secretary, and honestly, I find the young man professional and professorial in his grasp of the challenges of universal health care. He has a clear way forward in achieving the mandate of the agency. His Excellency, I thank you for appointing him. The burden of out-of-pocket health expenditure of our people. Every stone will be turned and all strings will be pulled to mobilize resources from within and outside the state to this effect. Our wealth of experience will be channeled to ensure the success of this scheme. I thank you all for coming. Thank you.
Your Excellency, please permit me to thank a few people. Your Excellency, I want to thank the Speaker of the Anambra State House of Assembly and also the members of the Anambra State House of Assembly, both present or absent, and more especially the members of the House Committee on Health for the diligent work, for the tedious work that they did in passing this bill in the first place. Your Excellency, I want to also thank your Honorable Commissioner, our Honorable Commissioner for Finance, because he headed the committee that you set up to work with the Anambra State House of Assembly to perfect this bill, to make sure it went very well. I am speaking of Honorable Commissioner Ifat Onejeme. You did a very good job with the members of the team. Permit me to also to thank National Health Insurance Scheme people that work with us. Like the Executive Secretary of NHIS stated, they had their initial problems at the national level. And they wanted us to not make the same kind of mistake. So they worked with us, and like he just said before, well, not too long ago, we avoided all of those mistakes that they made when NHIS was formed or when it started at the federal level. Let me also use this opportunity to thank each and every one of us here for being here. Your Excellency, a lot of the credit goes to you. I am happy to be standing here. Arguably, I am the happiest person here today. When I left the United States of America and relocated to Nigeria, and I contested for this office that I'm in right now, it was one of the things that I had in mind. Because those of us that have had the opportunity to live in other climes, the Western world, America, USA, and the rest of them, can testify that health insurance is needed in any society, and more so here in Anambra State. And as a key player to the passage of this bill, I must tell everyone here that today is my day, and I am very happy for that. I am saying it not because I am the only one, but I want to just express how happy I am about what we are doing today. Your Excellency, what you did today is great and it's monumental. You are giving the opportunity to the Anambra to have health insurance coverage, which is very, very important. Health is wealth. Health is number one. Without good health, you cannot do much. It doesn't matter if you have 10 billion in your account. If you're so sick and you can't move up, you can't even spend that 1 naira of your 10 billion. You will even say, take this 10 billion and give me good health. What we are doing today with this launch that we're doing about this Anambra State Health Insurance Scheme, Your Excellency, your name has gone into the annals of history as far as this state is concerned.
Let me stand on the protocol ably established by the Conqueror. I'm happy to welcome you all to this event. In Anambra, today marks the beginning of quality, affordable, and accessible healthcare delivery in our Anambra State. It also marks an end to avoidable suffering, preventable disability, and careless death for our people. After a careful planning, my administration has stepped out to make sure that everyone in Anambra State has a chance to enjoy a quality healthcare service. And when I say everyone, I actually mean everyone that is living in this great state, including the poor, the rich, the young, the old, men, women, etc. The scheme also comes with very special offers for pregnant women and for children under the age of 5. In Anambra, this is a revolutionary scheme. It is probably the most affordable quality healthcare delivery scheme in this part of Africa. With just 1,000 naira a month per person, we offer a comprehensive scheme that covers preventive care, curative care, and rehabilitative and surgical services for a whole year. In Anambra, what this means is that if you register for the scheme with 1,000 naira and continue to pay your 1,000 naira every month, you will get a top quality medical attention for whatever disease or ailments you might have for a whole year.
just 1,000 naira per month. Indeed, I'm very hopeful that our illustrious brothers and sisters shall easily take up the challenge of offering insurance cover to their relatives and to their towns and communities and even local government areas. Since it costs only 12,000 per person per year, I have no doubt that some of our brothers and sisters will underwrite this cost for their relatives in the spirit of Onye Ayana 1 year. I also urge employers of labor and members of the organized private sector to organize and buy policies of their staff from this scheme. Similarly, I advise members of professional associations, social clubs, age grades, not to miss this great opportunity to buy a rewarding policy for themselves. In the Anambra, at this juncture, I am delighted to announce to you that Anambra State Government has paid for policies covering 10,000 people from across the state. The modalities for equitable distribution of this offer are being worked out to ensure that every community is adequately represented amongst the beneficiaries. At the same time, my administration shall pay 10% in counterpart funding for the coverage of all civil servants and their families. So as you can all see, we're already leading from the front. In the Anambra, my administration has always given health sector the priority attention it deserves because we believe that health is wealth. That is the reason why health is one of the key enablers of my economic blueprint. Essentially, we approach health from three broad categories, namely the primary, the secondary, and the tertiary healthcare arrangements. Interestingly, this administration has recorded quite some impressive achievements in primary healthcare delivery in the past 5 years. And in specific terms, we have renovated 83 primary healthcare centers and provided 63 keke ambulances. We also provided 17 speedboats and 6 water ambulances for the riverine communities. 2 escort life-saving ambulances were also added to this fleet recently. In addition, we have finally established the Anambra State Primary Healthcare Development Agency. Ladies and gentlemen, we achieved even more in secondary healthcare delivery. They include the upgrading of 3 general hospitals in the state to a specialist status in the senatorial zone, namely Onitsha, Ekulabia, and Enugu General Hospitals. Next is upgrading of Mafia Psychiatric Hospital and the ongoing renovation of 18 general hospitals in the state to provide services, accreditation, and a robust participation in the Anambra State Health Insurance Scheme. In tertiary healthcare delivery, we also recorded some impressive achievements. They include the successful accreditation of the School of Health Technology, Obosi, with 6 departments, the successful accreditation of Chukwuemeka Odumegwu Ojukwu Teaching Hospital, the successful accreditation of the School of Nursing and Midwifery, Mbo, and perhaps more importantly, the accreditation of the final MBBS program of Chukwuemeka Odumegwu Ojukwu Teaching Hospital to ensure the graduation of the first set of medical students from the college who, because of lack of accreditation, had to stay for 10 years in the university. Of the residency training in O&G, pediatrics, and community medicine, and finally, the donation of over 747 million to mission hospitals, as well as the sum of 250 million to medical support to vulnerable members of the society. In the Anambra, these are some of the achievements of my administration in the healthcare delivery so far. We still have a lot of headroom for improvement, and we shall not relent until we put Anambra State on the map
for exceptional healthcare delivery. Ladies and gentlemen, what we are launching here today is indeed a visionary healthcare scheme. I have no doubt that when it hits the operational peak, it will inspire a new thinking in medical insurance in Nigeria. However, no matter how good this initiative is, it will not achieve its objective if we do not take ownership of it and give it the support it deserves. So I urge you all to take the policy today. I also charge all healthcare providers in Anambra State to turn over a new leaf and commit to providing quality healthcare services to our people. Anambra deserves nothing less than the best healthcare services in the world. Dalono umunnem. I got you. Well, it is my pleasure to unveil the plaque to commemorate the official flag off of the Anambra State Health Insurance Scheme. And I'll do this in the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Round of applause, please, for His Excellency.
Anambra State Health Insurance Scheme. We have the Anambra logo that is there with the usual sign of medicine and medical practice there. And the abbreviation of Anambra State Health Insurance Scheme is ASHIA, if you will, ASHIA. So this is the Anambra State Health Insurance Scheme. So please try and pick up a health insurance scheme as we elucidated earlier, either for yourselves, your immediate family, your community, for a group of people you like, and it's for everybody that lives in Anambra.
Thank you, thank you, thank you.
I feel greatly honored with the opportunity to give the vote of thanks at this gathering. I remain particularly grateful to His Excellency, Chief Dr. Willie Obiano, the Executive Governor of Anambra State, for making out time out of his busy schedule to attend this event. It is also important to know that the idea of the health insurance scheme right from inception to actualization was that of His Excellency. Thank you, sir, for always looking out for Anambra that are in the lower rungs of the economic and health ladder, and for raising the bar and scoring another first in governance. We are humbled by the encouraging words of the Executive Secretary, National Health Insurance Scheme, the Chairman Governing Council, Royal Fathers here present, and all dignitaries for your goodwill messages. We cannot fail to recognize the presence and influence of the Honorable Commissioner for Health, the Honorable Speaker, and members of the House of Assembly. We are also indebted to our partners and friends, non-governmental organizations, the head of service, for being resolute and responsive to the challenges we face in our bid to create a controlled and affordable healthcare system.